The truth is the economy is crummy. Are you kidding? I'm not putting all my eggs in a basket. Plus, Denver is only an hour and 10-minute drive, okay? I know, you're thinking after a 12-hour shift, are you kidding? I do it every day. I live in Monument, I work in Denver. It's an hour and 15-minute drive each way for me. I find it really relaxing.
I know people who live in Denver and still drive an hour and a half in town.
That's right, for the traffic. But think about that. Your expectations from the agency. What are your expectations? You can say, I understand that you work every other weekend. That's an expectation. Yes, I understand as nurses we work 50% of the holidays. It's an expectation. You expect to not have to work more than that. Or you may be very interested in saying, do you have any programs that there's bonuses for working weekends only? Because those are hard to cover. What do you offer for additional educational benefits? Those can be expectations from your agency or facility you're looking at. So they may say, well, after you've been here 12 months, we pay for anything that's an A or a B in your continuing education, because we support nurses' continuing education. Do they offer in-services here to help me stay current? Those are important questions for you to know for your career, because you're lifelong learners. So those are important questions that you can expect from them. Talk about what was your favorite clinical rotation when you were in school. I was really passionate about whatever it was because blah, blah, blah. Have a reason. Not, oh, I love peds. And what did you love about it? The fact that they were 5 and sick? You know, what is it that intrigued you for that? Strengths of your program. Because each of the programs that y'all come from have very strong strengths. So you need to know what those are. You've heard them. We tell you. We don't keep it a secret, right? So it may be that when our graduates graduate, they absolutely have all of their skills down. They are absolutely ready to hit the road. That's fabulous. We need to hear that. What qualifies you for this position? Because I have an RN license, right? I want to work. I like taking care of people. That's okay. Those are wonderful answers. They're honest. They're heartfelt. Because your interviewer wants to hear from you what you're passionate about. Because I'd much rather hire somebody who's passionate than somebody that's, well, my instructor told me I would do well here. Great. And why might that be? Any previous work experience you have, no matter where it was. Gee, I sold clothes at Macy's. I really connected with my customers. I was in claims, so I got to talk to folks about what they didn't like about the billing. So I dealt with difficult customers day in and day out. Those are skills you can apply. What else can what other positions? I don't want to taint your thoughts. Babysitting. I was given the responsibility of taking care of another person's child and keep them safe for a period of time. So I had to understand growth and development, what foods they might eat, and I had to understand how to keep them safe. And I had a plan, if anything went wrong, what I could do to keep them safe. So don't rule out babysitting. It's awesome. It was an experience. You had a responsibility. You knew what to do with that. So don't discount your prior experiences. Think of student scenarios. Like I was telling you, come up with, when I was a student, I had this type of patient. This is how I was challenged. This is what I did, and here's the outcome for my patient. You're not the key piece, the patient is the key piece. Okay? We're here to take care of patients. Having said that, a very key point is take care of yourself. I hate it when nurses say, I've got a 12-hour bladder. And I want to say, and how many bladder infections do you have? Right? I couldn't take lunch. So you're so important. You couldn't delegate to your fellow teammate for 15 minutes. Think about this a minute. So self-care is very important. Sometimes getting off the unit, and down in the cafeteria, getting my food, bringing it up, gives me a whole fresh look at my patients. Because now I can think of it from their perspective. I understand why the family was gone for 2 hours. Did you see the line in the cafeteria? It was out the door. What's going on? The food here is so awesome. They come in from out of the community to share food. I know you're thinking, I don't think so. Hospital food. And then the biggest thing is when they ask you a question, you're thinking, I don't have a clue what they're asking me. Say, what I think you're asking me is, and give your answer. And I may say, well, no, that's not what I meant. But what does that do? That says to me, the interviewer, reframe it. You're not clear. Doesn't mean you didn't hear it right. Means that the person asking the question probably didn't ask it. Or the other thing is stop and listen to the whole question. Don't formulate your question while they're halfway through. What would you do in a scenario if you were floated down to the clinic and they were overloaded and you have a backup of 50 patients and they told you to triage those patients to see who should be seen first? If you stopped listening to me and you heard me say, I'm floating you down to the clinic, you aren't going to be able to answer the rest of the question. So lots of questions are complex questions. Let them ask the whole question, and it's fine to say, that's an interesting question. Give me a second. What I think my response would be, or what I've done in the past is, so it's okay to take a couple of minutes. Silence is not your enemy. I know we think it is, but it really isn't. Reflective thought is just wonderful. I'm thinking about what you asked me. Because if I went and I asked each one of you, who is your favorite patient and why? Okay, I got that. Now tell me what's unique about that patient. Now you've got to step back and think. Was it their diagnosis? Was it care? Was it your connection? Was it something else? In an interview, what we're really looking at is, can you think on your feet? Because that's also going to tell us how you're going to respond with a patient. Because when you walk in a patient room, you have an agenda to change that IV. The patient has an agenda. Now the doctor was just in and he said, so can you meet the patient's need and also do the safety at the same time? Or a family may say, now why are you touching that? Well, because the IVAC keeps going off and it's driving me nuts. It's got to be driving you crazy. Okay? The other thing I suggest you should do with patients is engage with patients. And it's okay to say that in the interview. I like engaging with my patients. So I see checking their name band as a way to hold their hand for a second.